Epithelial Sodium Channel Blockers, or ENaC Blockers, are one of two types of potassium-sparing diuretics available. They block epithelial sodium channels in the late distal convoluted tubule and cortical collecting duct. Normally, these channels facilitate the entry of sodium into the cells that line this particular section of the nephron. From here, 3 sodium ions are reabsorbed into the blood by a sodium-potassium ATPase pump in exchange for 2 potassium ions. The potassium then diffuses into the filtrate for excretion, and the movement of sodium creates an osmotic gradient, which water can follow to become reabsorbed. Blocking epithelial sodium channels with ENaC blockers reduces sodium availability within the cell for the sodium-potassium ATPase pump to exchange for potassium. Therefore, less sodium in water is reabsorbed, creating a mild diuretic effect, while at the same time decreasing potassium secretion and thus loss. There are 2 main ENaC blockers, Triamterene and Amiloride. They are commonly used with other diuretics, such as loop or thiazide, to counteract potassium loss. ENaC blockers are also used with other diuretics to treat hypertension and edema. The most common adverse effect of ENaC blockers is hyperkalemia, or elevated serum potassium, typically greater than 5 milliequivalents per liter, which can result in life-threatening arrhythmias. Other side effects can include nausea and vomiting, muscle cramps, and dizziness. ENaC blockers are contraindicated with hyperkalemia. Caution should be used when taking ENaC blockers while frequently consuming salt substitutes or potassium-rich foods, as it increases the risk of hyperkalemia. Generally, individuals on this therapy will require routine blood work to measure serum potassium. Additionally, avoid taking before bed to prevent nocturia or the need to urinate during the night. And finally, some drug-to-drug interactions worth mentioning. The risk of hyperkalemia increases when ENaC blockers are used with other potassium-sparing diuretics, angiotensin-converting enzyme inhibitors, angiotensin II receptor blockers, or potassium supplements. I hope you found this video useful, and if you did, please let me know by giving this video a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!